So let's take that conversation forward now. And in order to take that conversation forward, we are now joined by Dr. Shashank Joshi to walk us through what his understanding of the new variant is and what he makes of the new surge in the cases. Dr. Joshi, good morning. Thank you for joining us. What is your understanding of the new variant? Is it time to panic or it's too early to do that?
No, I think it is not a time to panic, but it is time to be concerned. This variant is called as B.1.1529. Now, normally the old variants like alpha, beta, gamma, delta, they all had 2 or 3 mutations. The receptor binding domain and various other spike proteins of the virus. So fundamentally, as you said, this has enhanced transmissibility. It has resistance to various neutralizing and therapeutic monoclonal antibodies. It may evade immunity and it may be more infectious. In fact, the world's dominant strain is Delta. And first time on planet Earth, the Delta is being threatened by this strain. What has happened is number of cases are very small, by the way. Only 77 cases in South Africa, 4 cases in Botswana, and 2 cases in Hong Kong. So actual number of cases of this strain are very less. However, it is rapidly displacing Delta dominance in South Africa, and that is what has concerned all the global scientists. The WHO is meeting today to know and identify whether it is going to be called as variant of interest or variant of concern, and it is likely to give it a Greek alphabet called NU. But of course, that is under consideration in the meeting today. But we don't know the clinical implications of this. So all it means is that today, the strongest vaccine against everything is wearing double mask or single mask which is N95, or if there is a cloth mask with a 3-ply surgical mask, and ensuring that the airborne droplet infection is prevented. We follow COVID appropriate protocols and get ourselves vaccinated. I don't think it will have a vaccine escape. That data is not yet available, but it may evade innate immunity. That means interferon antagonism has been documented because there is a NSP6 deletion on it, which is Delta 104 to 107. So that is what has been documented. So there is no major cause on vaccine evasion. So currently our advice to everybody is get yourself both your vaccine shots done and ensure that even if you're vaccinated, wear your mask all the time whenever you are in an environment which is outside the bubble or house.
So the surge of corona cases, especially in Europe and US, is that largely because of the winter effect and a casual approach towards COVID protocols?
So the pandemic which is being there in Europe and US is a pandemic of the unvaccinated population. There is a substantial population in Europe and US which is not been vaccinated. And it is the unvaccinated population where the pandemic is spreading, and it's all the Delta strain. So currently the European dominant strain is Delta, so is the US strain is Delta, and it is the unvaccinated population which is dominating the current, closures like Austria, Slovakia, Czechoslovakia, and various other countries, including United Kingdom. So it is important that we get ourselves vaccinated. Even in India, many people have not got a single dose, or maybe one dose, but a second dose has been delayed or deferred. So our appeal is that please get your second shot if you are eligible. Please ensure that if you have not got a single shot, get yourself vaccinated and try to complete both the shots of vaccines, because the current pandemic worldwide is being driven by the unvaccinated population.
Dr. Joshi, what is the right approach countrywide right now? Because India was just about beginning to open the country's doors to international travelers. Do you think one needs to curb such moves purely in anticipation because one doesn't really know how this new variant is going to pan out?
I think that will come as a global guidance very soon. You saw that United Kingdom has already banned 7 countries from Africa not to travel. They have a travel embargo in place, like Botswana and South Africa, etc. I think right now, today WHO will meet and take a decision on the same. India might have to be a little more cautious. Actually, in Hong Kong, they had 2 patients which were identified. And Hong Kong is the only country in the world where there is a mandatory 21-day quarantine. In our travel, we have opened up everything. Our quarantine is self-quarantine and home quarantine. So we need to be disciplined. We are not following COVID-appropriate behavior. So we will need to do a lot of self-discipline and self-control. But I agree with you that there might be an embargo placed by the Ministry of Health after their due consideration, after the WHO advisory on global travel from those countries of interest like Botswana and South Africa. But I think we should all get and help our people from Africa to get themselves vaccinated, because only 1 in 4 healthcare workers who are taking care of COVID patients in Africa are vaccinated. So our idea is to ensure that they get vaccinated as early as possible. Again, the biggest threat worldwide is that till there is going to be an unvaccinated pool, there is going to be an active virus in circulation and there will be pressure for it to mutate. And we still need to mask and ensure that we follow COVID-appropriate behavior, particularly in crowded spaces, and avoid crowds.
Sure. Dr. Joshi, always great to speak with you, and I'm sure again, we'll speak again soon. Thank you so much for taking the time out.